If you've been told your TMJ pain is a bite problem and that braces or aligners are going to fix it, you've been given the wrong answer. I've seen what happens after the answer plays out. It isn't pretty. You've been living with clicking, headaches, jaw pain that radiates into your ears or up into your temples. Someone looked at your teeth and said your bite was off and told you that straightening them would take the pressure off the joint. So you spent several thousands of dollars and 1 to 3 years in orthodontic treatment and you still hurt. Maybe it's worse than before. Now there's talk of more treatment, maybe a different appliance, maybe something surgical. And the thing nobody will say directly is that the braces didn't fix it because the braces were never going to fix it. I'm Dr. Tim Batista. I am a dentist, a medical physician, and an oral and facial surgeon. Being trained as both a dentist and a physician, I treat thousands of TMJ patients, including a steady stream of patients who come to me after orthodontic treatment that made no difference in their facial pain. I started tracking what these cases had in common. The pattern is one of the most consistent things I have seen in this practice. The problem isn't that orthodontists are doing the treatment wrong. They're doing it exactly right. They are incredible. But what I didn't expect when I started digging into these types of cases was that the problem is something that gets decided way before anyone ever looks at your actual jaw. And it's something that most patients have no idea is even a question. I'm going to show you why the bite correction theory for TMJ keeps getting recommended even when the evidence doesn't support it. Why some patients actually feel better during braces and then crash when treatment ends. And what's actually been driving your pain this whole time. Point 1, your bite is not the cause of your TMJ pain. Now, I want to be very clear here. Orthodontists are amazing. They do incredible work to improve the lives of those they treat. I work with them every single day. They are the good guys and they are on your team. If you have misaligned teeth or a bad bite, there are a myriad of reasons why you should correct your bite. Better hygiene is possible with straightened teeth. There's increased lifespan of your teeth when they are in proper alignment. You can get incredible aesthetics with a good straightened smile. Social confidence comes with it, mental health benefits, the list goes on and on. A bite problem is easy to see in any jaw pain patient who walks through the door because many patients with TMJ pain or jaw pain do have a bite problem. So when a patient walks in because they have jaw pain and a bad bite, are they offered braces to fix their bite? Absolutely, and they should correct their bite. Is there a reason to correct their bite for TMJ pain? No, it is not. It is for all those other positive benefits mentioned earlier and many more. Do patients think that fixing the bite will fix their pain? Sometimes, yes, they do. Do they hope that fixing the bite will alleviate their pain? 100% they hope for that. We all hope for this. Is it going to happen? That is what we are going to talk about today. The most common theory TMJ patients receive from friends and family goes something like this. Your teeth don't come together the way they should. That misalignment is probably putting uneven stress on your jaw joint. Correcting the bite will take that stress away and let the joint heal. It sounds completely logical. Your jaw joint is connected to your teeth. The teeth are off. If you fix the teeth, you fix the joint. This theory has been circulating in dentistry and orthodontics for decades. It has a name, occlusal theory, which is a fancy way of saying bite theory. And the reason it's stuck is that it's not crazy. The jaw joint does respond to bite forces. The teeth and joints are anatomically connected. But the research that was supposed to confirm the link between bite correction and TMJ relief never landed the way the field expected it. The evidence that fixing the bite reliably resolves jaw pain is weak. And yet the recommendation kept getting made because orthodontists are generally excellent at correcting bites, and many of them need their bites corrected. And here's what makes this so difficult. Some patients actually do feel better during orthodontic treatment, which feels like proof that the theory is actually working. Unfortunately, it almost never is. The improvement some patients notice during braces has almost nothing to do with the bite being corrected. When you're in active orthodontic treatment, you're seeing your provider regularly. You're wearing appliances that change the pressure in your mouth. You're paying attention to your jaw in a new way you weren't before. Teeth move because of slow, constant pressure. That pressure changes the focus of your mind from TMJ pain or jaw pain to a new sensation surrounding the teeth. That attention may also reduce clenching, which reduces muscle load, which temporarily reduces pain. The underlying problem hasn't changed. When the treatment ends and the attention drops back, the pain comes back because nothing that was actually driving it was ever touched. Once you stop looking at the bite as the answer, you can start asking what's actually generating the pain. And that question has a specific answer that points somewhere completely different from the orthodontist chair. But here's where it gets more complicated. The right answer depends on which of two very different problems is actually happening in your jaw. And most patients have never been told this distinction even exists. Point 2. There are two different problems, both commonly called TMJ, and treatment for one won't work for the other. Most patients who get a TMJ diagnosis assume they've been given one specific thing. TMJ is TMJ. Some patients have it worse than others, but it's all the same underlying issue. So when a treatment doesn't work, they assume they need more of the same, a better night guard, a more aggressive bite correction, a different appliance. They never consider that they might have been treating the entirely wrong category of problem from the start. There are two completely separate things that commonly get called TMJ. The first is a problem inside the joint itself. Think of a small disc that sits between the two bones of your jaw, like a shock absorber. When the disc slips out of position or the joint surface deteriorates, you get pain, clicking, and in more serious cases, locking. That's an internal joint problem. The second is a problem in the muscles and the nerves that surround and control the joint. These muscles can go into chronic spasm from years of clenching, grinding, and holding tension in the jaw. They generate pain that radiates into your ear, your temple, the back of your head, your neck, and sometimes even your teeth. That's a muscle problem. It is in the same region, but it's a completely different source, and they don't respond to the same treatment. Up to 85% of people who come in with a TMJ diagnosis are actually dealing with a muscle or a nerve issue, and not a joint issue at all. That means that many people are being managed for a joint problem they don't actually have. But there are specific patterns that separate them, and they show up in things you've already noticed about your own pain. In the next section, I'm going to show you how you tell which one you actually have, because that answer changes everything about what comes next. If you're new here, I'm Tim Batita. I am a board-certified oral and facial surgeon. My journey and training took me through dental school and medical school, which means I am both a dentist and a medical physician. And I have spent my career training the cases that did not get resolved somewhere else. I tell my patients exactly what they need to know. Subscribe if you want straight answers from a surgeon who fixes problems when other treatments do not work. Point 3, how to tell which problem you're actually dealing with. The two problems show up differently in your body, and the differences are specific enough that you can start identifying yours right now. Here are the questions. Question number 1. When your jaw clicks or pops, does it hurt right in front of the ear canal where your joint popped or clicked? A disc that has slipped out of place can click and cause pain. It can cause severe pain. If this is happening, it is likely an internal joint problem. Question number 2. Press firmly on the muscles that are just in front of your earlobe. It's along your jawline and up into your temple. Do you find spots that are tender when you push on them? And when you press on those spots, does that pressure recreate the same familiar pain you've been living with? These are commonly called trigger points, and this is not an internal joint problem, and it indicates that it is likely a muscle issue. Question number 3, has your jaw ever actually locked? Not just felt stiff or tight, but genuinely refused to open or close fully. True locking is almost always a joint problem. The disc is physically blocking movement. Muscles can limit range of motion through pain, but a jaw that mechanically stops is a different thing entirely. This points to a joint problem. Lastly, bite on a popsicle stick or a Q-tip with the molars in the back on one side of your mouth. Now, where is the pain that you feel? If you feel generalized pain on the same side of the face that you bit down on, that points to a muscular issue. If you have pain on the opposite side, localized right in front of the ear canal, that points to an internal joint problem. So if you bite down on the right side and you feel pain on the left joint, localized here, that's a joint problem. If you bite down on the right side and you feel pain in the face on the right side, that is more likely a muscular problem. Now do the same thing on the other side. Bite down on the other side. If you have generalized facial pain here on the same side as the side that you were biting on, it is more likely a muscular problem. If you bite down on the left side and you feel localized pain right in front of the ear canal, that is more likely a TMJ issue. So to recap, if you have pain or locking from a jaw joint when it pops or clicks, it points to a true internal TMJ problem. If you feel pain as you press firmly on the temple or the jaw in these areas, it is more likely a muscular issue. And with the popsicle stick, if it is painful on the same side as where you bite, it's usually a muscle problem. But if you bite down on this side and it's on the opposite side right in front of the ear canal, that's more likely a TMJ issue. Muscular issues tend to be more common, and that is actually the more easily treatable diagnosis because it responds well to conservative treatment and rarely requires surgery. If your answer to these questions pointed more towards a true internal TMJ problem, you need someone evaluating that joint, not adjusting your bite. Either way, the path forward becomes clear once you know which one you're dealing with, and neither path goes through an orthodontist. So what does the right path actually look like? Because most patients who come to me after years of the bite correction have never been shown the sequence of treatment that should have been offered to them from the very beginning. Point 4, the treatment that should have come before braces ever entered the conversation. Every jaw and joint patient, regardless of whether their problem is in the joint or in the muscles, should start at the most conservative treatment available and only move to something more involved if that approach proves inadequate. That sequence is not optional. Skipping straight to bite correction isn't efficient. It's how patients end up in my office after thousands of dollars invested into a jaw that's no better than when they started. The longer the actual source goes unaddressed, the more established the pattern becomes. Muscles that stay in chronic spasms for years get harder to reset. Joint problems that go unmanaged can progress. The window where conservative treatment works best doesn't stay open forever. The way I treat both muscle and TMJ issues works like a ladder. You start at the lowest rung and you only move up if you need it. The first rung is conservative therapy, reducing load on the jaw, specific exercises, massage therapy, thermotherapy with heat, stress management support, etc. A significant number of patients improve substantially here and never need to go higher. If that's not enough, the next rung is medicinal. This includes specific anti-inflammatories, muscle relaxers, etc. If a patient is amenable to taking medications for a brief window, I work with them on a regimen that is specific to them that joins conservative therapy with the medicinal therapy. My goal is not to keep patients on medications long term. It is meant to break the cycle and allow for a recovery period, then go back to conservative therapy alone and weaning off the medicines. The next rung is minimal procedures. For muscle issues, I include medicinal Botox in this category because it requires a licensed practitioner to perform the injections. Botox injected directly into the overworked jaw muscles forces them to relax. This Botox treatment is not for cosmetic reasons. Botox for facial muscle pain is applied deeper and more abundantly. I've had patients who couldn't open comfortably for years get real relief within 2 weeks. Above that, for joint-driven problems, we have arthrocentesis, which is a small needle procedure done under IV sedation that flushes the joint space and restores normal movement. Arthroscopy is the next level that inserts a camera into this procedure to help with treatment and with further diagnosis. The next level after that is TMJ disc removal. It's a surgical option for those with disc disorders. And at the very top, for joints that are degenerated beyond repair, TMJ total joint replacement is a good procedure to reconstruct and restore proper function and cure TMJ pain. That last rung is where a small fraction of patients end up. Thankfully, most patients resolve their issues well below that. Braces do not appear on any rung of that ladder. Bite correction was never part of the sequence because the bite was never the source. Before your next appointment with anyone, ask one question. Ask them directly, is my pain coming from inside the joint or from the muscles around the joint? And what in your evaluation tells you that? A provider who has done that work will have a clear answer. A provider who hasn't will hedge or steer you back to the treatment they already planned. That answer tells you everything about whether you're in the right room. Point 5, what to do tonight before you spend another dollar. Most people with muscle-driven issues around their TMJs are loading their jaw constantly without realizing it. Teeth touching during the day, jaw braced under stress, clenching through very difficult conversations or commuting. The muscles never fully rest, and a muscle that never rests cannot recover no matter what treatment gets layered on top of it. Here's what to do starting right now. Check your jaw position at this moment. Your teeth should not be touching. Rest position is lips together, teeth apart, tongue resting gently on the roof of your mouth. If your teeth are touching right now, your jaw muscles are working when they shouldn't be. Set a reminder every hour today. Teeth apart, jaw loose. That single change alone produces noticeable results for a lot of people within a few days. Find your trigger points. Press firmly on the muscles just in front of your earlobe, along your jawline, and up into your temples. Use gentle pressure in a small circular motion. When you find a spot that's sore and recreates your familiar pain, hold gentle pressure there for 30 seconds. Then apply a warm compress for 5 minutes. Not ice. Heat relaxes muscles and increases blood flow. Ice is for an acute injury. What you have is chronic tension. And before bed tonight, do 5 slow jaw opening cycles. Open as wide as you comfortably can without pain. Hold there for 3 seconds and close slowly. Do that 5 times. This keeps the joint moving and reduces the morning stiffness that builds when muscles are tightened overnight. Tomorrow morning, before you get out of bed, notice where your jaw already is. Are the teeth touching? Is tension already present? That tells you how much your nervous system is driving this even during rest. Write it down. It matters for whatever conversation you have next with your provider. Braces are one of the most effective tools in dentistry for what they're designed to do. Straightening teeth is extremely valuable. It has a unique job different from resolving jaw pain, and the two have been conflated long enough that patients are losing years to the wrong treatment. If your jaw still hurts after orthodontic treatment, that is not a sign you need more of it. It's a sign the actual source of your pain has not yet been identified. Find someone who will identify it before they recommend anything else. If this gave you a clear picture of what's actually going on in your jaw, the next video to watch is this one. It goes into exactly how I evaluate every new TMJ patient I see, what I'm looking for before I ever make a treatment recommendation, and what a real evaluation should actually include. It is in the description and it's on your screen right now. I'm Dr. Tim Batita. Stay healthy, share your smile with others, and I'll see you in the next video.